Hi, Dr. Lindsey here. I'm going to take you through this repair case. This is an about 40-year-old medical professional who's had 2 hair transplants with moderate success before he came to us. Now, he's got fantastic donor hair. It's thick and wiry, and it's got great roots on it. So you might ask, why didn't his previous hair transplants work? Well, because he looks like this before. And if you look carefully, it looks like he's got a little bit of hair, kind of here in the front, and then maybe some that comes back this way. But he's ultimately probably a class 6 hair loss who's wasted a bunch of hair. And he had 1 strip case, and his scar was a little bit wide from somebody else, and 1 FUE case. And if you're going to FUE anybody, these thick hairs are typically the hairs that will survive. Now, if you watch enough of my videos, you'll see that, in my opinion, if you need more than 2,000 grafts, FUE just makes you look donor depleted. And so I think he's wasted, I was not able to figure out how many FUEs he got, but I'm going to show you the strip in a second and show you where some grafts were taken and some weren't. I think he wasted some hair with an FUE unsuccessfully, and he definitely wasted hair with a strip. And I think the reason it didn't work with a strip most likely is because the doctor that did his previous cases didn't trim or shave his head in order to do it. And again, if you watch enough of my videos, we don't shave people's heads in order to lose business because nobody wants to be shaved. However, even when you have hair my length, if I'm trying to make holes tight enough that you're going to get a natural hair transplant result, I can't do that without damaging the hairs that are there, which we all know are most likely going to go away anyway. And when those hairs go away, even if every hair we put in lives, it's simply not going to be enough hair. Secondly, the ladies that place the hair at our office can't see to make those holes, can't see to find those holes because of surrounding hair. And lastly, even hair this length will stick to the new grafts, and over the course of the first week, pull a significant percentage of these hairs out, the new hairs out, before they even take root. So that's my best guess as to why a guy with really good donor hair got kind of a crappy result. So of course, he's a medical professional, he's had 2 unsuccessful surgeries, and he's nervous. I mean, this happens all the time, but it's even worse with doctors because now they're really overthinking it and trying to figure out whether there's something inherently wrong with their ability to heal. So I think he brought his wife. I think she's also a medical professional, and we talked about it for months before we proceeded, and we did this strip procedure. And we cut this out, and it's fantastic hair. We got 2,800 grafts out of him. I suspect that if we'd gotten to him before he had his previous surgery, the density would have been even higher. We'd probably gotten 3,500 grafts. Now take a close-up look at this strip, and you'll notice that it's pretty dense, but there's some holes in that strip that don't have any hair. And those are spots where an FUE procedure actually worked and got the hair out. And so here's a side view. So now you can see a bunch of hairs, and now you can see a spot where there's no hair, but there's a scar. And so for everybody that tells you that FUE doesn't make scars, first of all, you can see it on everybody that shave their head. Here's an example. But now you can see how it scars underneath the surface of the skin, which is why the first FUE can be easy or hard. The second FUE will definitely be harder than the first, and the third becomes very difficult simply because of the scar tissue underneath the skin. So we put the hair in. He did a good job cleaning, and then I heard from him pretty much weekly for a few months, because he's a nervous fellow that was afraid that it wasn't going to work again. And around 6 months, he said he wanted to come in for pictures, and I said, listen, on a repair case, I'd prefer you to wait about 15 months. But he was in our area and stopped by almost 1 year to the day after his procedure, and here he is. This is a significant change from his before picture to now. His hairline looks unremarkable. My donor scar is very good. He does have significant hair loss in the back of his head, and now he's got a much more limited amount of hair to work with. So there's no chance he'll be able to cover all that. But we talked about whether to do a second case behind his first case and give coverage to the front 50% of his head. And I think he's likely to do that at some point. So to summarize, FUE definitely scars on the skin and beneath it. If you're going to get a hair transplant, even though it's a pain in the butt, I think you'll get a better result if the doctor will trim your hair or shave it or get it so close that at least you can get the hairs put in as dense as they need to be. Plan for the future. This guy's now had 3 hair transplants and essentially has hair on the front 30% of his scalp. Had he done this with a better plan and better execution, he'd probably have hair almost to the front of his crown. Maybe even farther back with 3 cases. And lastly, be patient. I think at 12 months he looks good. At 15 or 16 months, he's almost certainly going to look better because it just takes longer on a second or third hair transplant. We do repair cases all the time. Prior to COVID, 80% of our cases were repair cases. If we can help you, please give us a call. Thanks.